Hi, my name is Monique, and I'm going to be doing your neck and heart assessment today. Do you have any questions?
No.
Okay, so we're going to go ahead and get started. Can you sit up a little bit, please, for me? Lift your head up, look straight ahead. Okay. Now I'm going to listen to your carotid arteries. Okay. And next I'm going to palpate your carotid arteries. One at a time, never two at the same time. Okay, if you can go ahead and lay down for me. Okay, are you comfortable?
Yes.
Okay. Go ahead and turn your head slightly to the left for me. Inspecting the external jugular vein. See there? Just press here a little bit so I can get it to poke out just a little bit. Okay. And looking at the internal jugular vein. It's located right here. Okay, then now I'm going to measure. I don't have a ruler, so I'm using a pen. At the highest point of the external jugular vein. Which is located right here to the sternal point. At a vertical angle. So pretending like this is the ruler. Okay, and I have it at 1 centimeter above the sternal point. And the head of the bed is up at 30-degree angle. Now I'm going to do your heart assessment. You go ahead and relax. First I'm going to do is inspect the interior portion of the chest. Okay. Next I'm going to go ahead and auscultate. I'm going to start at the aortic, at the second intercostal space on the right side. Next is the pulmonic, the second intercostal space on the left side. The Urbis point at the third intercostal space. Next is the tricuspid at the fourth intercostal space. And last is the mitral at the fifth intercostal space at the mid-clavicular line. Just using the diaphragm. It also takes the high point, the high listening point, and I'm going to switch it over for the bell. This measures low frequency sounds. Going in the same places that I was before. Okay. And next I'm going to palpate when I'm palpating, I'm checking for any thrills. Thrills is like a rolling sensation underneath your fingers. I shouldn't have any of that. Okay, and then lastly, what I'm going to do is use the heel of my palm of my hand and stuff. Same spots here. And what I'm checking for is any lifts. Lifts of any ventricular activity. I shouldn't have any of that. Where we lift my heel up off his chest. That could be an indication of an abnormality, meaning enlarged ventricular, which they call it ventricular hypertrophy. Okay, if you want to go ahead and sit up. Okay, we're done with your assessment. Just to go over your head, your neck. I mean, when I did my assessment there, what I was doing, looking for any carotid narrowing, which could be make your vessel there feel like it's thick, which means you would have atherosclerosis, which is thickening of the arteries and stuff. That's due to cholesterol plaques. Okay, and you were fine there on both sides. I also checked for pulses and stuff to make sure that it was irregular and stuff, which both of your carotid arteries are regular. I also inspected your thyroid, looked for symmetry, which is fine. It didn't have any shifts. When we did your chest assessment and stuff, I looked for, make sure there wasn't any pulsations throughout your chest, which there was none present. All your heart signs in your aortic, your pulmonic, your Erb's place, the tricuspid and the mitral valve, they were all regular sounds. No thrills or bruits. You didn't have any bruits here in your neck, and that's what we're checking for too. It's like a swishing sound, and we didn't hear any of that. All right, did you have any further questions or anything?
No.
Okay, you can go ahead and get dressed. Thanks for your time.